So pleased that you come today to attend our second session in our series, Climate Changes Health and Health Equity. And today our focus is on mental health and well-being, including eco-anxiety. And today our speaker is Dr. LeRoy Anderson, and he is an MD. He is a graduate of the University of Utah School of Medicine, completing residencies in general and child adolescent psychiatry at the University of Washington, Seattle, and the University of Utah, and remains board certified in both. During the course of his career, he's served as medical director of behavioral medicine inpatient outpatient unit at Dixie Medical Center in St. George, where he was the only psychiatrist available for a population of over 100,000 people. He's been director of medical staff at Dixie Medical Center, medical director of the Closerville Clinic, Children's Outpatient Services, a Spanish-speaking clinic, and medical director of the Carmen Pingree Center for Autism. He's also on the clinical faculty, has served on the clinical faculty of the Psychiatry Department here at the University of Utah School of Medicine, and as medical director of outpatient psychiatry services at Utah Valley Hospital. He served in multiple roles at Salt Lake Valley Mental Health and had private practices in St. George and in Salt Lake City. He's also served as a consulting psychiatrist at the Utah Boys Ranch and Cross Creek Manor. Although he retired in 2017, well, certainly deserved that, right? Dr. Anderson continues to be involved in locum tenens work, psychiatric residence education, and maintaining licensure and board certification. And Dr. Anderson is going to explore the relationship of physical health stressors to anxiety, PTSD, grief, aggression, increasing suicide rates, and depression, and will provide information on the effects of climate change on vulnerable populations. So let's put our hands together and welcome.
My goodness, that's quite the introduction. I wasn't quite aware of everything that I've been up to over the past several years, so it was good to hear it. Again, thank you, Joan, so much. It's such a pleasure to be here, and I'm so excited to be here. I'm glad this session is being recorded, because really it's been my desire for a long time to extend my circle of influence as far as this issue of climate change, and now including the issue of mental health along with climate change. I'm very grateful for you all coming here and attending, and for those who are watching this on the internet maybe a little bit later, thank you very much for logging in and watching this. It's a great pleasure for me and a wonderful opportunity. So thanks to all of you. Thank you, Joan. And I want to thank Dr. Anderson last week, the cardiologist who began this lecture series, because I think he provided a great introduction to the personal consequences and some societal consequences as far as the medical effects that we are facing with this issue of climate change. But what is my goal? Why do I want to be here today? Why was I excited to have this opportunity? The main reason I'm giving this talk today is not really it is a little bit to educate you and make you a little bit more climate literate. But the main reason I want to be here is to hopefully find someone, and there are people in the audience who are doing this already, but I want to find somebody who is right now not doing very much, maybe feeling a bit anxious, but I'm hoping that I can motivate some people here, hopefully a lot of people who are listening to me, to take some steps and extend their circle of influence, broaden their impact, and help themselves and help other people as far as this issue is concerned. So what I'm hoping to do today is educate to some degree, but more importantly, I'm hoping that I can motivate some people to actually think of taking some steps, to help us resolve this issue or at least mitigate this issue to some extent. Let me tell you how I personally became invested and involved in climate change. Why don't we start playing that first video here. This is a video of a trip I took in 2015. In addition to being a psychiatrist, I'm also a very active scuba diver. And my favorite environment in the world, the most beautiful places I have seen since I've been born, have all been under the water, in the ocean. Nothing can compare. This is a video I took diving Sordo Bay, which is in Raja Ampat in Indonesia. This is probably the healthiest coral reef remaining on the planet. And the reason it's so healthy, you see all these beautiful, pristine staghorn corals and table corals, other variety of hard coral. Hard coral is much more affected by climate change than soft coral, it turns out. But this is such a healthy reef because this particular area is subject to underwater upwellings. And so the water is colder in this area than it is in many other areas of the world. And we see beautiful, beautiful coral reef like this. And so it was my privilege to be here. In fact, the most beautiful place I have ever been in my life was a place called Carl's Ultimate Reef, which is a reef off Papua New Guinea, just above the Great Barrier Reef. And I was on a special rebreather expedition. That's a special kind of scuba apparatus that does not make bubbles. It recycles your air. And because of that, you don't threaten the fish at all. And so you can swim through these clouds of anthias. And so we had coral underneath me, beautiful varieties of hard coral, surrounded by all these beautiful small tropical fish, the anthias, and then the mid-sized tropical fish. And then we had 2 giant silver-tipped sharks accompany us on the dive, swimming in and out of the anthias, swimming around us as we were doing the dive. It was the most magical moment I think I've ever had. That was my apex outdoor moment in my life. Okay? So I have fallen in love with this environment, and it's very special and very dear to me. Okay? So sorry about that, guys. Next slide, please. When I took one of my other dive trips, this is a dive trip to Palau in the late 90s, after hearing about Palau being the 7th underwater wonder of the world. I was swimming over the coral, and the first dive we did, with the tour guides, we came upon, I don't know if the tour operators exactly wanted us to see this, but we saw acre after acre, vast as far as you could see, of this kind of a situation. And next slide. And this is another slide. These are not slides of Palau in particular. These are slides of Samoa, taken from online, but it's exactly what I saw when I was in Palau. And I guess the sorry about that, guys. The emotion, I would say, is it's heartbreaking to see something like this and to be aware of it. You notice, the other water above this, you've seen from the surface, the ocean looks perfectly healthy, perfectly okay. And there's something even more heartbreaking than seeing a completely dead reef like this. And what has been more heartbreaking is I've gone diving in various locations throughout the world, is seeing reefs in distress, seeing reefs half alive and half dead, and the corals obviously struggling to stay alive. And so this has caused some personal investment for me, because I know what a beautiful reef looks like, and seeing this gradually spreading is distressing to me, and causes, I guess, what you would term some eco-anxiety among other emotions for me. This is kind of why I have a personal investment in this issue. Okay, next slide. I was thinking of what environment that I could relate to when I was diving in Palau. And as I was diving the reef, this image kept kind of flashing in my. This is the first time I've had an opportunity to share this, but this is what was kind of going on in my mind. Who knows what this is a picture of? Raise your hand. This is Hiroshima. Yeah, this is Hiroshima, but I imagine Dresden would be the same thing. Yeah, very, very similar. Okay, and so at any rate, feeling a sense of loss, anger, sadness. Also for my children, not so much for me because I've kind of gotten there under the wire to see some of these beautiful things. But I have 5 children. All 5 of them are certified divers, and they've all seen beautiful reefs. But I wonder, will they be able to, have the same experience with their children that I have had? Because we're on track now to lose 99% of our reefs throughout the world if things aren't changed by 2050. And that's a cause of anxiety for me. You might think, well, is this the only environment that's been affected? But it turns out that we have a lot of other things to worry about too. I just saw an article last week in National Geographic. We're down 3 billion birds from previous years, about 20 years ago in North America compared with earlier. Insects have been carefully measured in terms of flying insects in nets above the canopy layer in wilderness areas in Germany and also wilderness areas in North America compared to levels found in 1980 or throughout the 80s. We are only getting half the weight of insects in these traps compared with these previous years. There's somewhat of an extinction burst, especially among amphibians and invertebrates. I've heard that the extinction rate is about 1,000 times the natural background rate, and we're losing species at a rate of 150 to 200 per day, according to best estimates that we have. Also, one thing very worrisome to me is not just the coral reefs in the ocean, but the plankton levels in the ocean. We've been measuring plankton levels since 1950. And since 1950, we have had a reduction of 40% in the amount of plankton throughout the ocean. How does this happen? Well, we have more CO2 in the atmosphere. CO2 dissolves in seawater. CO2 forms carbonic acid. Plankton have calcium carbonate exoskeletons. And when calcium carbonate comes into contact with carbonic acid, calcium carbonate dissolves. And so this is of special concern to me because what is our source of oxygen on the planet? To a large extent, it's from our plankton. And so we need to be worried. I mean, we haven't seen changes in the oxygen levels in the planet yet, but it's something that I think because of what's happening with our plankton that I already have some concerns about. Another issue related to oxygen levels is the fact that in 1980, about 14% of the Earth's surface was covered with rainforest. Currently, about 6% of our planet is covered by rainforest, and we are losing rainforest. This isn't a result of climate change. It's more of a cause of climate change also. But we are losing rainforest at the rate of about 1.5 to 2 acres per second. So that's another thing to be worried about. Here in Utah, as far as our snowpack is concerned, I'm a skier. I enjoy skiing as well. and of course, we all like water. Our snowpack is reduced in terms of average amount year by year from 1980 decade levels to currently. It's gone down by about 41%. And so we are seeing some changes. Now, I was hiking a couple of weeks ago in Moab, and I went down a canyon with my family. Oh.
Grandkids.
Oh, yes. Okay. Just a couple of pictures of my grandkids, concerns I have. Okay, go ahead. Thank you, Laura. Yeah. Yeah. Okay, go ahead, Laura. Yeah. Riley, and these are Laura's sons. Okay. Yeah, I was hiking A couple of weeks ago in Moab, going down a canyon called Dragonfly Canyon. Beautiful little canyon. We had a wonderful time, but we were stopped by a lot of people needing to rappel and waiting for the person to finish rappelling, this kind of a thing. And so we didn't know, we weren't expecting this, but we ran into hordes of mosquitoes. And we all got a lot of mosquito bites. And we were thinking nothing of it, thinking, well, this is okay. I mean, shooing away the mosquitoes. But later, we went shopping at Lynn's, and what was in the newspaper on the front page, this was the lead article. Moab women infected with West Nile virus. And there was also another person in Salt Lake infected with West Nile virus. And we learned last week from Dr. Anderson that mosquitoes carrying yellow fever, and the type of mosquito carrying yellow fever, and the type of mosquito carrying dengue fever, that they've also been identified in Utah, probably as a result of, less cold winters and less insect kill. So maybe there is something hopeful in this. We aren't losing all of our insects, right? We are getting some insects. Unfortunately, a lot of them turn out to be vector insects, like we discussed last week. Okay, so anyway, how are you all feeling now? Have I got everybody cheered up? Okay. Yeah, this warm, happy, fuzzy feelings, going on as I review all of this information. So I think it's pretty obvious to you right now. This talk is not about climate change in general. It's about the emotional impact of climate change. And so that's why I reviewed all this information, so you could kind of register with yourselves and see what you're feeling right now. And, maybe it wasn't such a bad thing that I got a little bit choked up, because I think you were able to identify, well, this guy's got a problem. Okay? And, yeah, I do. And I think it's one that's shared by a lot of other people. So anyway, let's see. So why can't people wake up? Why can't people do something about this? How about the next slide, Laura? Okay, what's this about? What relevance does this have? Does anybody want to explain this for me? I'm tired of talking. Someone can maybe explain this. Yes, go ahead.
It's the idea that if you want to cook a frog, don't turn it on really fast, because then it'll jump right out. But if you
Right.
boil it.
Okay. And so, does this have any relevance for why people can't, be aware of what's going on with climate change?
Sure.
Okay, I think everybody gets it. I don't think I need to belabor the point. How about the next slide, Laura? Okay. And this is an artist's rendition of a particular ship. It's the Titanic, resting on the bottom of the Atlantic Ocean. And does this have relevance to the issue of climate change? Well, the climate is something that's huge. It's overwhelming in terms of its size, right? Well, I don't know of a larger boat that I can think of than the Titanic, and people, as they were riding across the ocean, what did they refer to the Titanic as? It was what? Unsinkable. It was unsinkable, right? I mean, people couldn't conceive of something that large having such a massive problem, but here we have it, okay? And even maybe when the Titanic struck that iceberg, the Titanic's a huge vessel, so maybe it was a quiet little shudder or something when it struck the iceberg, and maybe some people down in the bottom levels were seeing an obvious problem going on, but maybe people up on the dance floor weren't so aware of something happening. And I just imagine myself hearing maybe somebody on this boat saying, well, people say there's a problem, but I'm not going to worry about it maybe until I get my feet wet. And so I thought this is a very nice analogy to maybe what we're suffering, and helps us understand maybe why people aren't taking steps like we would want to have them take. This is a slow crisis. This is not a sudden crisis. So it's a hard crisis to recognize and to respond to for that reason. But for some, it's not quite so slow or quite so abstract. Maybe we can take the next slide. This is Vanuatu. This is close to some of the areas where I've been diving in the past. There are a lot of low-lying atolls in the Pacific. Pacific is covered by them. Vanuatu is one of them, and even very minor storms now are causing people to have floods, and indigent people in this area are facing relocation needs. They're going to lose their place of living, lose their livelihoods, and of course become refugees in as much as they won't have some place to live. Also, another interesting indigent situation is illustrated by the next slide. And this is in northern Canada, in the Northwest Territories. And let's see, these are the Inuits that live here, and for years and years they've relied on what they call ice roads, because the tundra itself is very boggy, marshy, and you can't travel on it. Fortunately, it's been cold enough in most years, in years previous, I should say, for them to build the roads out of ice. And as you can see, in recent years, this has been more of a problem because the ice roads for the Inuit are starting to collapse. And just like for the islanders, these people are facing relocation and loss of their typical environment. And I'm wondering what the emotional state of this truck driver is. I'm wondering if he'll want to keep driving trucks on ice roads too much in the future. My guess is that he'll probably make a career change. Okay, so another reason why it may be so difficult to face climate change is because it's a very strange situation in our country. For some reason, this has become a wedge issue politically. I mean, are earthquakes wedge issues? Are I don't know, is any other kind of local tragedy like a flood or like a bank robbery or something like this, that when it occurs to people, does this drive political parties apart? It seems strange that this has been something that, if you're a loyal member of some party, you have to, avoid and not have much to do with, and the other party you have to go a little bit more supportive. It's a very, very strange situation. That's why I love being a member of Citizens Climate Lobby, because one of our main efforts in this particular organization is to make it less of a wedge issue and more of a bridge issue. But it has impaired a lot of people that feel like they're betraying their loyalties if they invest in helping with this particular issue. Okay, so now we can get to maybe what this talk is supposed to be about in the first place. Okay, it's supposed to be about personal and psychological consequences of climate change. Let's go on to the next slide. Okay, and this is relevant because this talks about heat waves. Okay, and heat waves have been an issue in Europe and also an issue in the United States. It's an issue because it exposes people who are particularly vulnerable, like mentally ill people, elderly people, disabled people, and actually probably a little bit more so in Europe, especially Eastern Europe, because many people here do not have access to air conditioning. And medically, you see more consequences with the heat waves, as you might have mentioned, as we discussed last week. But also with heat waves, you see a doubling of emergency room visits for mental health conditions such as suicide. You see higher rates of aggression during heat waves, and you see also higher suicide rates during heat waves. So let's go on to the next slide. This is another obvious consequence. You might imagine this is Hurricane Dorian in the Bahamas. I wonder what the incident of post-traumatic stress disorder might be if you were a resident in one of those homes following this event. And like I say, we've always had these events. They're just becoming more common now as we are exposed to climate change. Next slide. This is Tornado Jolie in the United States, and once again a similar situation. And one thing about these disasters that's important to realize, and probably in my mind the most important mental consequence of climate change, is that these occurrences put vulnerable populations at risk. The mentally ill, the elderly, the disabled, people like in normal times when we don't have any of these disasters, the care of these populations is compromised to begin with and not adequate. And when society has to take care of something like this, and when the mentally ill or vulnerable person has even added stress, they're even less likely to have a response in terms of providing them the assistance and the aid that they need. And so this is a devastating impact for our mentally ill population and for our homeless population. Next slide. And you all know what this slide is. This is the recent wildfire in California. And of course it produces similar issues. Post-traumatic stress disorder for many of the residents. Loss of livelihood, loss of income, loss of personal residence, need for relocation, actual probably refugees who are citizens of our country. Imagine that, needing to relocate and live elsewhere. Okay, and let's see. So let's go on to the next slide. This was covered last week very well by Dr. Anderson, the cardiologist, going over the physical impacts of situations which are impacted with climate change. He talked in one thing I found particularly interesting for Salt Lake was the fact that you see double the amount of heart attacks, during inversions. And he mentioned that. Why is this the case? For those of you that were here, who was here last week? Who can remember? Dr. Reiser, do you want to explain for us why we see inflammation? Right. How does inflammation occur as a result of? Why is inflammation important?
PM 2.5, I think, actually penetrates the circulation.
Right. So you see more inflammation. You see that involving the arterial system, and when that involves the arterial system, you're more likely to see clotting, and you get more heart attacks. Okay, so that's just explaining one medical condition that has a direct, relationship with dirty air and unclean air, and then you can, extend that to problems with water supply, environmental degradation that we talked about, extreme heat and severe weather. But all kinds of interesting things can happen, like increased rates of cholera in vulnerable countries, also changes in vector ecology, and of course the injuries and fatalities arising from the adverse weather events themselves. Okay, next slide. Okay, and here's ostensibly why we're here today, to talk about how this all relates to our community health, to societal issues, and also to mental health. We've mentioned much of this before, but it's becoming documented now that we are seeing increases in depression, stress, and anxiety, strains on social relationships, complicated grief, substance abuse, post-traumatic stress disorder, loss of personal identity, and helplessness and fatalism. It's interesting because in the articles that I read regarding suicide, spousal abuse, aggression, all of these problems seem to have about a 50% increase across the board during heat waves and adverse weather events. So it makes it easy for me as far as statistics are concerned, just to realize about what level of increase that we are seeing. As far as societal impacts are concerned, we see a decrease in cohesion, a sense of not belonging, also feeling of many people that they have been betrayed by their leaders. Why don't we go on to the next slide here? Who knows who this is?
Greta Thunberg.
Yeah, that's Greta Thunberg at the congressional hearings. And what is she saying right here in this slide? Does she look happy or does she look concerned? She looks quite concerned, doesn't she? And what she is actually saying is, I feel betrayed by my leaders. I feel that they are not, taking my life into account. You guys are more worried about the short term than you are the long term, and I'm worried about my future. And so, a good example, and I in particular liked what she said. Don't listen to me so much. Listen to the scientists. Which is I think a great message. But
this is the interview or the hearing where she gave them a copy of the IPCC report and said, "Don't listen to me. I'm not here to testify on the science today. I'm here to tell you to listen to the science, and here's the IPCC report."
Okay, so wonderful. What Jonah's saying is what Greta is doing here. She's trying to extend her circle of influence by linking herself to other people. And I think that's a great way not only to become involved in this program, but also to reduce your own sense of eco-anxiety or sense of frustration and not knowing what to do. Linking yourself to other organizations and other people. So anyway, let's go on to the next slide. And these are some Syrian refugees at the Turkish border. You can imagine what's going through their mind, what kind of problems they're facing, and what emotions they're having as they're bringing their family members, in this desert, no place to go. Of course, these refugees are caused by the presence of war in the area. But what causes wars? Largely it's due to competition over resources. And what impacts resources? Climate change impacts resources, leading to personal loss, personal trauma, and a lot of, aggression, violent behavior. And what's more of a mental illness than war? I can't think of a more important, mental illness than that particular societal situation. And not to mention the suffering these poor people are going through. Okay, next slide. But all is not lost. Okay, I love this logo here. This is a logo of the Blue Sky program in Rocky Mountain Power here in Utah. And I personally elect to use Blue Sky. Does anyone know what Blue Sky is? Okay, Blue Sky is a program whereby you pay your power bill, but all of your payment goes towards the establishment of renewable power, towards the windmills that you're seeing here, and also paying for solar farms to generate energy in this manner. And so that makes me feel a little bit better knowing that I'm involved in that activity. There are other things that you can certainly do. For instance, you can volunteer. You can try to communicate. Let's go to the next slide. This is something I did a few months ago. It's a letter to the editor and explaining, my involvement with the coral reef situation and telling other people, trying to tell other people what my concerns are. David Folland, who is in our group here today, has been a marvelous example, both in terms of his activity for Citizens Climate Lobby, but also in terms of writing letters himself, as well as many other people who are trying to do this. This helps the issue, makes people more aware, but also helps reduce your own anxiety, your own depression, your own guilt as you participate in pro-social activities like this. Doing simple things, walking and biking as much as you can, taking the bus, all of these are helpful. One thing I liked in particular about the report of the American Psychological Association and Eco America was they made the special point that any good deed you do will act to increase your own resilience and act to help other people. So if you go down and volunteer at the food bank, if you give somebody else a ride to work, anything that you're doing in terms of service is going to indirectly mitigate whatever effects climate change may have here locally, or really any other bad situation. So you can consider yourself a climate activist if you're simply helping your neighbor. And so I love that idea, and it gives everyone a chance to participate and be more active as far as reducing some of these impacts and morbidities that we've been talking about today. So anyway, as far as communities are concerned, what can communities do? I think one thing that is critical is that we pay attention to our vulnerable populations. And when we do have any kind of adverse event, that we have transparency and that we make sure that there's equity in terms of how resources are allocated. One thing that was very helpful in the Chicago heat waves that they noticed, there was a 50% reduction in deaths in parts of Chicago that had green spaces. So anytime you're out gardening, you're having a climate impact. And when you're advocating for green spaces in your community, then you're also having a climate impact and also a mental health impact for other people. One thing that I've also been very encouraged by is, let's go on to obvious. Okay, here's a great example of a green space. It's the most beautiful green space I think I've seen, for many years at least. There's the Bouchard Gardens in Victoria, British Columbia. Just a really beautiful place, and it just kind of lifts your spirits to be in a place like this. And it turns out it lifts your spirits and increases your chances of survival if you take regular visits in the park, at least during heat waves that we've found. So that's great. And let's go on to this last logo. I live in Mill Creek, and one thing that has really made me happy about living in this area is that they have made a decision as an administration for all of their activities to be completely carbon neutral and green. And so I feel if these people can do it, maybe I can do it in my personal life as well, and other people can do it. And of course, many of the Scandinavian countries are becoming more carbon neutral, and I figure if these countries can do it, then we can probably do it here as well if we have the will to do so. But anyway, I want to kind of finish up here by talking about us. I don't know how many of you here are professionals or leaders in healthcare or mental health care, but I think we have a special duty that is a duty to warn. For example, if we have patients coming to us that are smoking, if we have patients coming to us that are driving recklessly, if I have patients coming to me that are engaging in reckless self-destructive behavior, I feel like I have a duty to warn them about changing their behaviors so that they can have a better life and a healthier life. And I think we also as professionals have corresponding duty socially we as professionals listen to scientists. That's why we're professionals. That's why people aren't going to a shoe salesman to get a hernia repair, for instance, okay? We go to people who have been trained scientifically to help us in ways that we need. And so when we need meteorological help, we should ask meteorologists what the situation is as far as the climate is concerned. And we do have a duty to warn, therefore, I think, because of our social position, and probably a little bit of an enhanced ability to do so as well. So let's get out there and let's start warning some people and having an impact. And in so doing, help our own mental health and help the mental health of other people. And that concludes the formal part of my presentation. We can open it up for discussion.
So, Dr. Anderson, you've talked about individual things that we can do as health professionals. One of the things that I have seen other professional organizations do is to band together and together make statements and take actions that are addressing climate change, and especially climate change and health. Has the American Psychiatric Association made a statement about climate change and mental health?
You know what? That's a great question, and I failed to check on that issue before coming here. So I'm not sure of their specific statement that they may have made as far as this issue is concerned. But it seems like I have a kind of a vague memory in my mind that yes, they are concerned about this issue, and we can look that up a little bit more carefully maybe as time goes on to find out what specifically they've said. But I think they would be in concert with other medical associations like the American Medical Association, American Pediatric Association.
American Public Health Association.
Yes, yeah, they've all gotten on board with this.
And there are a group of healthcare associations that are now working together, bringing their statements together, and bringing that to the attention of the government. So.
Yeah, let me just mention. I didn't mention this during my little lecture here, but it's a point that I think is well worth making that Joan is bringing up. We're talking about voice amplification here because, I, like probably a lot of you, have kind of felt helpless with regard to this issue. It's such a big issue, and there's such an amount of political will that we have to overcome regarding these problems. It's very important to link with others to amplify your voice. I think becoming part of a professional organization, becoming active politically, writing letters to the editor, becoming involved in local government like people have with the Mill Creek situation. And they've done it in the Holiday also, and also in Park City, which is gratifying to hear. Joining national organizations such as the World Wildlife Fund, such as the Citizens Climate Lobby, other organizations, your voice is going to be more powerful and more effective if you link with others. And you're going to feel less helpless, and you're actually going to have more of an effect if you get together with other people and work together. So that's one way we can warn also, and warn more effectively, is if we do have a common voice as opposed to just kind of sitting in our living room and worrying about this issue by ourselves. Any other comments or questions? Yes, Krishna. This is my good friend Krishna. He goes hiking with me every Friday as part of the University Emeritus program. He's a retired professor from the Division of Mines, and so welcome, Krishna. Go ahead.
That was very interesting talk, LeRoy. A question that this this emphasis on talk to your scientist. It's a voice of reason, and surely that's what we have to do. But the truth is that sometimes for a certain segment of society and for some time, the voice of reason doesn't work. These people who are currently even professionals and on the top political sense who say, oh, this is just a hogwash, climate change. Do you, from the psychological and psychiatrist point of view, have anything that doesn't seem so reasonable, but we can still do to contradict this attitude that this?
Oh, thank you. That's such a pertinent point and a great thing to bring up. Well, I'm a psychiatrist, and I've seen one mental problem very commonly over the years, and that's the problem of denial. I see people who've had devastating physical problems who continue to abuse their bodies because they simply don't believe that they have a problem. It's the issue with their doctor, it's the issue with their spouse, and I think we are seeing this a little bit in our community at large. I would think, since it's going to have a negative and potentially devastating impact, if it's not resolved, I can kind of conceptualize that in terms of reducing our ability to function well. That's kind of the definition of a mental illness, isn't it? So, yeah, denial is something that we have to struggle against, have to work against, and have to fight. Sometimes we need to fight it a little bit indirectly for us to be effective. Sometimes confronting denial head-on is not something worthwhile to do. Sometimes it is. It depends on the person, doesn't it? But that's a very important issue to think about and be aware of. Oh, here we go.
I am not a health professional, and I'm afraid I don't understand the link between the climate crisis or climate incidences and suicide and domestic violence. I don't make that link. I don't understand that. And then secondly, when a client comes to you who has been abusive, what do you say? I mean, there's such a range of possible reasons. How do you decide that climate is relevant in that response?
As far as these studies are concerned, I don't think they examined or investigated the particular reasons why people behave as they do. And as you say, I'm sure that's different for every person. The research is limited to just incidence rates, and we have found that, yes, episodes of violence, anger, aggression, self-destructive behaviors, it's correlated. It's correlated. And, I think for me it's kind of easy to understand, because I think if you're on the edge anyway and you've got some additional stress and you've got other things going on, maybe a fewer community resources available, there's going to be a higher likelihood of something bad happening. And this is just, I think, a reflection of that. So I wish I could answer your question better. Does anybody else have any ideas that may be more relevant or direct? Oh, Danny? Yes, go ahead.
I read once that some report about how not take care of ourselves and our environment makes like a snowball effect. It get increased. And so I wonder, like, how do you see that is like happening right now in the world? Because it's I can see like the people is not taking care of ourselves and also the environment. So how do you see that we can reverse that or we can stop it?
Okay. So yes, how do you stop self-destructive behaviors, some multiplying and becoming more intense with time. And I think the first step is, of course, recognition. You have to be aware of what's going on. I think what we talked about with the Titanic was sort of an example of that. I mean, it's best if you have a disaster going on to be aware of the disaster, to not be in denial regarding the disaster, and to make some kind of active intervention for the disaster. Let's suppose you're on the Titanic and no one around you believes that there's a problem going on, and they just continue to dance on the dance floor. It's still probably going to help you to run out to the lifeboats and be ready to jump in when someone starts being aware of the problem. So yeah, your individual actions do make a difference, and of course that's what my presentation is about today. I'm hopeful that my efforts today will maybe make a little bit of a nidus for a snowball, so that someone here who is not being active in terms of caring for themselves, caring for the environment, maybe being of service to other people, not communicating, if they can take a step in that direction, then I'll be happy I came today. Okay, so yeah, thanks, Danny. I appreciate you reinforcing that. Oh.
I just wanted to say something to address your question, because correlation doesn't equal causation, but you can kind of imagine a potential causal link between someone who feels like they are experiencing the effects of climate change and feels like it's real and feels like their future is compromised. You can see how if they are already depressed, they might be more likely to commit suicide. And you can, I don't know if you've heard a lot of kids in their 20s these days saying, I'm just not going to have kids myself because I don't see any point. I don't see a future for them. So it's not necessarily a definitive causal link, but you can kind of make one.
Yeah, thank you, Laura. And and this has been particularly a sad situation because the people who are aware of the situation, the people who are maybe willing to do something about the situation, maybe the people who are not having children, okay, and the people who are clueless, maybe having large families, okay. Not that I want to criticize them really for doing that, I don't, okay. But I'm saying it's important for the people who are aware of the situation to have faith. And why is faith important? Faith is important because it leads us to take action. If you have no faith that anything that you do is going to have an impact, you're not going to do anything. So maybe the action that some of us can take is to have faith in ourselves and faith in other people. That will bring us to the point where we can get moving. I think that's very important, Laura. Thank you. Oh, yes.
Dr. Anderson, I want to thank you for your presentation and your comments on the importance of taking action. The therapeutic effect of taking action really rings true to me. I hope no one minds if I actually mention an opportunity that we have as Utahns right now to take action on climate change. There's a ballot initiative that a small group of us are working on, Clean the Darn Air, that is basically a carbon tax for the 2020 ballot. If voters were to approve it, we'd be placing a modest tax on fossil fuels. We use the money from that tax to get rid of the state sales tax on grocery store food. So we're shifting tax from food to fossil fuels. So it'd be a wash for most families, more or less close to being revenue neutral. But there'll also be $100 million every year for clean air projects in the counties that are most polluted. Now, why I'm doing this, why I'm involved and excited about it, is that if voters in Utah approve this, and I think we can vote it in 2020, we will be the first state in the country to have a carbon tax. And so Utahns will be moving the entire country forward. So we're getting down, we're struggling to get enough signatures. So I'm going to pass around some signature packets you can sign if you'd like. But we could really use help. We could use help gathering signatures, and we're getting to the point where we're not going to be able to gather the signatures with just volunteers. And so if you know anyone with deep pockets who would like to move the country forward on climate change, this is a relatively cheap thing or way to do it. So thank you very much.
Well, I appreciate you bringing up that initiative and providing a way voluntarily, which is great for anyone who wants to. And it's important for people to be aware of opportunities. It's important to be aware of things you can do and things you can join. David has a. Oh yes, okay, David, go ahead.
Yes, thanks so much for your comments. I just wanted to mention one of the resources. I appreciate all the people who are here because I think all of us who are here are actually concerned about this issue and want to take steps forward. But this is the third annual Utah Climate Week, and there's climate-related activities going on every day of the week. You can go online, Google Utah Climate Week 2019, and find things. There's movies. Thursday night, for instance, one thing we're involved with is a mayor's town hall where we have mayors from Sandy, Cottonwood Heights, and Mill Creek on a panel talking about what cities are doing and what we can do. Also, the county health department is having a climate and health symposium at Clark Planetarium on Friday and Saturday. So anyway, since we're in Climate Week, for people who are stimulated from your talk and want to take more steps, getting involved in any of the activities of Utah Climate Week is something we can all do.
Thank you, Joan. Now one more plug. Let's all go out there and do something, okay?
Absolutely. And so in terms of doing things, you could come to the series next week and join us again for another discussion on climate change's health and health equity. If you are a healthcare professional that needs continuing education credits, you can get CE credits for this session. There's a sheet on the table right out there that you can get your CME or CNE education credits for that. And I'd like to suggest that you think now about what you've heard today and the recommendations and actions that Dr. Anderson has suggested today. Think about how you can take an action individually that will strengthen yourself and your resilience, and about an action that you might take then to influence someone else to get involved. Maybe you invite them to Climate Change's Health and Health Equity presentation on Tuesday next week. Oh, excuse me, not next week. Next week is fall break. I'm glad I caught that. It's the following Tuesday. And then think seriously about a systemic action, an action where you are involved in changing something bigger than yourself. That could be in your workplace. That could be in the Utah State Legislature, or laws that are being passed, or people that are running for office that support and understand climate change. Or it could be in many other ways. We've got so many issues that are related to climate change, to our air quality, to our health, and many ways for you to get involved. There's some more information on the table as you leave today. There may be still some food left on the table. So feel free to stay and talk. Thank you so much for coming today. Oh, one last thing. There's an exhibit. There's an exhibit upstairs on the main level and the upper level of the library. It's Climate Change's Health and Health Equity, and it's based on the Lancet Countdown Report, blown up images of some of those images in the report, and also animations that you can find on the web. So today's the first day of our exhibit, and it will be running all the way through the month of October. So thank you.